Welcome to another episode of Clear Lake Connections, where we talk to the people behind the business of Bay Area Houston, proudly sponsored by UTMB Health. Today's special guest, Dr. Meredith Ford, and you are a professor at UTMB for nursing?
Yes, the School of Nursing.
It's a pleasure to have you on.
Thank you
We're here
for
to
having
talk
me.
about some heavier stuff, I guess. We're talking about men's health, prostate in particular. Tell me about why this topic's so important.
Yeah, so a little bit about my research background is looking at prostate cancer patients, but more so looking at the partner and the relationship and how a prostate cancer, since we call it a couples disease, how it impacts that relationship. Because I think that sometimes we forget to talk about the partner when we're looking at prostate cancer.
Yeah, and I feel like UTMB does from past guests does a really good job of focusing not just on the disease, but the person and their well-being in general. And this sounds like that's what you're trying to do with this research.
Exactly, that holistic care.
So how prevalent is prostate cancer?
So 1 in 8 men will have prostate cancer in their lifetime. So pretty high chance that one will get diagnosed with it. However, we call it kind of a watchful waiting cancer, where it's not something that is going to kill a man right away. We're hoping that we can catch it early with our screening techniques, but it's slow growing. So sometimes we can kind of watch it develop and before we do any treatment for it. So, but currently we've got 3.3 million men in the United States that are living with prostate cancer, whether they're receiving treatment or they're having that watchful waiting.
So talk to me about well, before we get to the treatment, let's talk about the symptoms, what to look out for. I mean, how do I play a role in helping detect this?
Absolutely. So we're hoping that we find it before you have any symptoms, because we want to see that we can do our screening techniques. So let me talk to you about that first. So every year, a man should go in after 50 years of age, as long as they're considered healthy. If they have any family history, they should start the screening at 40 years old. So they go into their provider once a year, and they're going to do a digital rectal exam as well as a prostate-specific antigen, which is a blood screening test. And if either one of those come back of concern, then we move on and we do a biopsy to go in and take a sample of the prostate and see if that patient has cancer.
So yeah, yearly screenings are important after 50, 40 if there's a history. So that you talked a little bit about the screening. What would I expect as a patient?
Yeah, so as a patient going into your provider, that digital rectal exam is going to be a physical exam that they do, and then the prostate-specific antigen is simply a blood test that they will do. Now, if that screening comes back high, they'll do a second one to make sure that it is definite, because there can be a lot of false positives with that. So they'll do that second one, and if it is still high, then they're going to move forward and they're going to do that biopsy. Now, we're hoping that we catch it before you have any symptoms, but sometimes a man will come in and say, I've got decreased urine flow, I've got I'm having trouble urinating, those type of things. And then that will kind of alarm us that we need to go ahead and do some of these screening tools.
And I probably should have led with this, because most men, we hear about the prostate all the time. What is it and why does it exist?
Yes. So it is deep in the pelvis. It's about a walnut shaped, and it controls your sexual function, hormonal, it's androgen, it's focused on your hormones.
Okay. So now I know what it is. I know why it's important. And that leads to your research. If somebody's being treated for prostate cancer, what is the treatment?
Yes. So there's several different treatments that one can have. Surgery being the first, which we call a prostatectomy, which is simply just the removal of the prostate and the seminal vesicles. When they have a prostatectomy has kind of been what's led me to my research, because that's usually the number one treatment that we will give. But the other things are androgen deprivation therapy, which is depriving because these cancer cells love hormones, especially prostate cancer. It's hormone driven. So they love hormones to grow. And so they deprive the cancer cells of the hormones. And then there's radiation. But predominantly the treatment of choice is usually a prostatectomy for anybody who is below 70 years old.
Okay, so that's the most sure way to address it.
Correct. Yes, we would love to go in, remove all of it, but of course you've got those adverse effects that come with removing the prostate, such as sexual dysfunction, urinary incontinence.
And how are those addressed?
So yeah, there's with urinary incontinence, you're hoping that over time those Kegel exercises that it will improve after about a year, but a year post surgery is when they say that how much recovery you've had is probably as good as it's going to get. And then with sexual dysfunction, of course, you've got medication all the way up to mechanical things that you can do, even surgery to kind of help with the sexual dysfunction.
And so that leads us to your research, because like you said, it's a couples issue.
Absolutely. Prostate cancer is considered a couple's disease. So with that specifically, it's considered a couple's disease even before the treatment. But when you have the treatment and they experience those adverse effects, that's when the partner really comes into play, because they're also experiencing some of these adverse effects. So yes, I did a qualitative study to kind of focus in on the partners to see what their experience was after their patient or their partner has had a prostatectomy.
And so what are some of your key findings, and what are maybe some of the ways to address the issues that pop up?
Well, I'll tell you a little bit of background. So I'm an oncology nurse. It's near and dear to my heart. My maternal grandfather passed away of prostate cancer. And then my father was diagnosed with prostate cancer about 5 years ago now. And so it's in my family. It kind of led me. But after my dad had a prostatectomy, I really saw that, what is this dynamic between my parents? What's happening here? So I went a step further, looked into the research, and saw there's not much out there to say what a partner experiences. So I did a qualitative study, which took me to 11 participants, and they were all 11 were heterosexual partners. With the patient, and they told me that their experiences, that they really try to protect their partner's manhood, that they felt like that after a prostatectomy, the man was that was his manlyhood, is what they felt, and they were very sensitive, feeling like they were walking on eggshells, and they didn't know how to help their patient, their partner, through that. And so they felt a lot of stress, anxiety. Some of them even said that they had to start addressing some of those mental health concerns that they were experiencing. So that was one thing. Now, the biggest thing I really wanted to look at was the relationship dynamic. What happens after this prostatectomy? So what I found was that these women don't care. They don't care that the urinary incontinence and the sexual dysfunction is happening. They really care about their partner and their partner's well-being, and that their partner gets cured of cancer. So that is what I found, which was so exciting to hear. Now, going back, hopefully maybe that second part of the study is looking to see what a man feels, because the partner didn't feel like the relationship changed. Actually, they felt like the relationship improved. And so now I want to say, would a man who went through this, would they feel that connection with their partner? Did it improve, or did they feel like it got worse?
Well, we're typically simple creatures and don't like to talk about things. So.
Well, that's going to be the problem, isn't it?
Well, I think that's what you're trying to address with that is
Absolutely.
Get that out in the open and get it taken care of, hopefully earlier rather than letting things fester and
Absolutely.
Get out of control that way. Tell me a little bit about you. How did you end up at UTMB?
Yeah, so born and raised Bangor, Maine. Went to upstate New York to get my undergrad nursing degree, and found that I wanted to go work at the number one medical center in the country. And so I came down to Houston. Since that time, I've married a Texan. Can't get out of Texas once you marry a Texan. But that's okay. This is home now. Went to UTMB School of Nursing to get my master's in nursing education. Worked in the oncology realm, became a nursing educator in oncology, but then decided I really loved the students and teaching and the academic side of things. So I've been in academia for over 7 years full time.
Yeah, tell me about the culture there. It sounds like UTMB is a place where you can go and you can find your passion, and then it seems like there's a lot of support there to let you develop that.
Absolutely. Now, UTMB School of Nursing in the last 7 years has seen me grow as a person, personally and professionally, and they have fostered both areas of my life. So, professionally, I was highly encouraged to go back and get my PhD. They told me, shoot for the stars. We're going to encourage you from the background, and that's what they all did. So, I got my PhD from Texas Women's University. They told me to go get School of Thought from elsewhere and bring it back to us. So, in that 4.5 years of doing schooling, I felt like I was encouraged by my peers, by the leadership, by my students. So, it was really exciting to cross that finish line and have all of them, they were right there with me.
So, we've addressed the problem. What are some of the steps you would advise these couples to go through in order to maybe hopefully alleviate some of these issues?
Absolutely. So I think first and foremost is catching, anybody who has the chance of prostate cancer, catching it early. So I would encourage the couple, since it is a couple's disease going through this, I would encourage both of them to be on board to make sure that they go and seek that primary care provider yearly to get that screening test done. Now, the advice that I have for somebody, post the prostatectomy is to really look at each other and that you both are in this together. I had one of my participants of my studies say that this is a road that neither one of us have navigated, so we're just trying to follow the GPS, but we're here together holding each other's hand. And I thought that was so wise of how they approached it, but really being in it together and making sure that from the jump, we're going to get our screening test done. And if anything comes back, that you are going to go through that process of making sure that everything's okay and potentially getting the treatment. Now, post-treatment, like I said, that mental health wellness for both the patient and the partner is extremely important. Even maybe some relationship counseling to make sure that they're on the same page.
Basically talking to each other.
Yes, doing that communication.
Yeah. So I've had several guests on that have been doing research at UTMB, but you're the first that I've come across in the School of Nursing. Tell me about that and how prevalent is that?
Awesome. Well, I'm excited to be your first. Thank you for having me. So I think, many of us in the School of Nursing are doing some capacity of research, whether that's educational research all the way to oncology research. Now, I have a PhD in nursing science, so my avenue is really looking at, as a nurse, what can we do? What changes can we make? So I'll give you the example of looking at this partner relationship. Now, from my study, I have suggestions for the medical community, specifically even nursing, to say, how can we address this and how can we improve for the patient and their partner moving forward? So my avenue is very specific, being that oncology background, but we've got, DNP, Doctorate of Nursing Practice, who are out there doing some quality improvement. And then we've got our PhD, the Doctor of Philosophy. But we're really in the School of Nursing trying to collaborate the two, because you've got the new research, you've got the quality improvement, and we need to be gelling those two doctoral degrees together. So we've been doing a lot of research with each other, separate, and out into the community as well.
Well, and I know the need for nurses has exploded, and so you guys do a good job over there getting them in. Talk about how teaching these nurses has changed over the years, because I imagine it's pretty rapid changes.
It sure has. Now, I'll tell you, in my 7 years full-time, 2 years before that, I was working part-time through UTMB School of Nursing, and how it's changed is these students are smart. They are very good with technology. So we are an Apple distinguished school, meaning that it's one-on-one. Each student has an iPad. We also, as faculty, each have an iPad, and we're able to be extremely interactive. In the classroom, it's high technology. So that has kind of stretched us quite a bit, because I think I'm decent at technology, but I've had to even try to keep up with the younger ones in the technology. So we're really trying to utilize more technology to meet their needs and how they learn best, as well as hands-on. A lot of simulation. We're doing simulation working with undergraduates and graduate students. So trying to also interprofessional, working with the School of Medicine, School of Health Professions, because that is what a nurse does. We don't just work by ourselves. We
Right.
work with the team.
Yeah. All right. So you kind of got into this because of a family history?
Correct.
Is that like the number one indicator of prostate cancer?
So actually increasing age, the average age that a man is diagnosed with prostate cancer is 67 years old. So it's one of those diseases that's considered somebody of higher age. But if somebody has a family history, it's usually a younger age, which is why they need to go and start doing their screening at 40 years of age, because it will come on much sooner.
Okay, so there's a hereditary component to this.
There is about 5 to 10. I think the literature says about 5 to 10% of those who have prostate cancer, it is from a hereditary component.
Okay, and what about that still leaves a...
A-
So do we kind of
Yes.
have an idea of what causes it? How is it just aging in general?
Yeah, so there's a lot of risk factors associated with prostate cancer. We don't know specifically one key indicator, but there are some things that we know. So you've got the family history, you've got those of advancing age, like I said, but also smoking. Smoking's never good. Smoking increases the risk for everything, excluding all types of cancer, not just lung cancer. So smoking does increase the risk for prostate cancer, as well as a high intake of fats and meats, so specifically red meat, and a high dietary intake of calcium. So those are kind of some risk factors that we have. But like I said, we don't know one specific reason as to why somebody could get prostate cancer, but 1 in 8 men. So it's pretty
Crazy
high.
Yeah. So the good news for men is it sounds like it's highly treatable.
Yes.
What lifestyle changes have to be made after you go through prostate cancer?
So with prostate cancer being the watchful waiting cancer, we hope we caught it soon enough that it has not metastasized, meaning that it has spread anywhere. Prostate cancer loves to spread to the bones. So if somebody starts complaining of bone pain, that is, for an oncology nurse, that's high alert. But really the changes that need to be made are being active, taking care of, if you do any treatments, the adverse effects that you have, taking care of that sexual dysfunction or that urinary incontinence, if that's important to you, addressing those type of things. But diet change, being active, all those things can play an important part in men's health.
And it sounds like it's very survivable. What are the survivability rates on prostate cancer?
So there are almost 300,000 new cases of prostate cancer this year. So almost 300,000. Only about 35,000 will die from prostate cancer. Now, I say from prostate cancer. It's not always necessarily from the disease itself. It could be the treatment or other comorbidities that a patient
So close
is
to a
experiencing.
90%.
Yeah, it's yes.
Okay. I like 90% better than 10% as far as odds go. So
Does sound a whole lot better.
yeah. Well, thank you so much for discussing this important topic. It's been a pleasure having you on, and continue your research. Sounds great.
Awesome. Thank you so much.
Thank you.